Okay, so let's talk about this comment. I don't know who Winston is, but I'm going to assume he's a dentist. He suggested to crown all of these teeth instead of wasting time on the fillings. Personally, I don't agree with that. He falls under the category of dentist that is not going to give you options and kind of makes the decision for you. I'm going to be the type of dentist that gives you all the options, gives you all the education, tells you what you need to succeed. We're going to start off by discussing crowns versus fillings. So if a patient has Medicaid, for example, insurance is not going to pay for crowns on all these teeth, rather they're going to pay for the fillings. Now let's pretend you have the money to get crowns on all these teeth. If you're jazzed up about getting a smile makeover and you have the money to do the crowns, then sure, we can go that route, especially on a tooth like this. The cavity's dragging. Probably if you look at the tooth in the mouth, it has a cavity on the cheek side and the tongue side of it. Sometimes x-rays don't show that. So yeah, if that's the case, let's crown it. But for a tooth like this, a premolar, especially if the patient is young, you don't want to go into crowning every tooth. If you're a dentist, you understand that if you crown a tooth and their margins aren't clean, the patient isn't flossing, those crowns can go downhill fast. So if a dentist is saying this to you, feel free to get a second opinion. It's not that he's wrong per se, he's just aggressive. But also he's a little jaded because he's used to patients not listening to him. So he doesn't want to waste his time on fillings because you're going to come back with decay on all these fillings that he did all this work on.